So welcome to our technical workshop on fathers and men's engagement in childcare. We're going to focus primarily on communication and advocacy issues, but it's going to be a journey until we get there throughout the workshop. A warm welcome to all of you. And my name is Mihaela Ionescu. I'm the program director in ISA, an international network of early childhood focused member organizations stretching in Europe and Central Asia. We have close to 100 members from 41 countries. And we are the international partner in the 4eParent project. More will certainly learn a little bit in a bit of a while. What 4eParent stands for: early, equal, engaged, and empathetic parent. Briefly to say, the project, which is a European funded project, aims to promote engaged fatherhood and caring masculinity as a means to prevent gender-based violence, but not only, by scaling up and mainstreaming methods and approaches that have been already successfully piloted during the EU Project Parent. So there's been already a history that the project is building on, with a few countries that have been previously involved, amongst which Italy has been also. And we will have some of the partners that have been leading actually this project with us today. The project identifies fathers and parents to be and fathers, parents of children under 6 years of age. So the focus is primarily on the youngest age group of children. They're the ultimate beneficiaries of the project. But we do focus specifically on the first 1,000 days. And that's important because this is a critical period in which we should engage father in an equal, shared, responsive, and empathetic parenting. And that is very important because the whole rationale for which the project actually is built on, it has multiple reasons and rationales, but the one that is we found it's extremely important is child's well-being and development. Today, we will spend 2 hours together, which I hope it will be an enjoyable time and it will pass without noticing. And here's the agenda that we have for these 2 hours. A very briefly introduction from myself and then from our colleagues from the Center for the Centro per la Salute del Bambino will be Giorgia Tamborlini. And we will start with an appetite for discussion, why engaging fathers matter. And I'm sure that we will have plenty of answers to this, but we will build this discussion starting from there. And we will see in a panel discussion, having different country perspectives, what actually are the evidences that we have around the importance of engaging fathers and why they should be involved in the nurturing care, especially in the first years of child's life. This is going to be the first panel discussion. And afterwards, we will dive into why this is happening or not happening. What are the enablers and hinderers in engaging men and fathers in care responsibilities? But all of these discussions about the evidence and what is blocking or what is supporting our efforts in having fathers and seeing fathers and men more involved in caring responsibilities, how that should inform our work for advocacy purposes. And that's perhaps a part that needs to be very well strategized by learning from what is out there and what the experiences are already in some of the countries that are involved today. Well, without further ado, I'm going to just briefly say what we aim to achieve through this workshop and hope that we will manage by the end of the 2 hours. We're just going to browse through the evidence that exists about the benefits of men and father engagement. We will reflect on the narrative of engaging men, how they are talked about in the area of caring, and how we can strengthen this narrative, how we can better support it and make it streamline it. And for this, we will learn from the country experiences today. We have Italy, Spain, and Portugal, but we have also colleagues that joined us from other countries, and we will definitely want to learn from their experiences by participating in the discussions. How we can collect these narratives and build the right narrative about engaging men and fathers. We will certainly want to learn what are the factors that are enabling and hindering our efforts and how we can streamline the narrative around engaging fathers in the early years. But also this should inform our priorities for an advocacy strategy for policy and social change. So this is really in a nutshell what we are planning for today, and hope that you are on board, let's say. I'm going to pass it now to Giorgio Tamburlini, who is going to give a little bit more information about the project under which we are meeting today, and then we will kick off the entire discussions. Please, Giorgio.
Thank you, Michaela, and good morning to everybody. Buongiorno. I'm very pleased we are together today, and we'll have the opportunity to exchange ideas and experiences about the core thematic aspects of this project, and particularly about communication and advocacy, which is so crucial for a theme which is essentially not only, but essentially a cultural theme. I'm a pediatrician by training, and currently I'm leading this NGO, the Centro per la Salute del Bambino, which focuses on the first 1,000 days. It focuses mainly on what we can do for families and parents, not only in terms of policies, parental leaves, cash transfers, but also in terms of real support to their skills and knowledge. So we see this project as absolutely crucial for the further developments of our work. If I can just have the first slide, which is again about the 4E project, Aicha. Yes, just to tell you about a little bit about the partners. First one, yes. The first, yes. The one above this one. We have apparently difficulties in moving around the slides, but anyway.
I am, yes. Can you see the slides now? I'm having some difficulties because my screen froze. So I don't know if what.
But anyway,
yes.
the project is led by the National Institute of Health, and I take this opportunity to bring to you the greetings of the Institute, and particularly of Angela Giusti, who's the leader of the project and is responsible for the prevention strategies of the National Institute of Health, with a focus on mothers, families, and children. The other partners, which I just will say a few words about, besides ourselves and ISA, are the circles of men, and Circolo degli Uomini, and you can understand that this group, this association that has a long record of work with fathers in different cities, is crucial for our project. And another important partner is Deep Blue, and Deep Blue will do something which is you can understand very important, which is the social media listening, so we can understand what is the mainstream thinking or the mainstream thoughts that are circulating about around this thematic area. Zadig is a lead agency in communication and also in training, particularly for health professionals. And then we have other associated partners like IRIS, UNICEF, an association of Italian pediatricians. So we have a very diverse and multidisciplinary group of partners in this project. If I can have next slide, Aicha will show very, very briefly what are the main components of this project. The one we are involved in today is the work package 3, which is about policy development. And we are, as CSB, the lead entity for this component. Another work package is working on training and capacity building. This part of the project is led by the National Institute of Health with our contribution. And then there is a further work package which is devoted to mainstreaming the thematic area across different sectors. We cannot have this slide, eh? It's not so important. So anyway, yes, thank you. And of course, we have a work package about coordination, etc. But we are mainly focusing on the policy development and on the capacity building. And while a third work package is involved in communication, which includes also trying to understand, as I said before, what are the main culture components around this thematic area. So this is more or less the structure of the project. We have a lifespan of 2 years. Of course, we hope to leave some sustainable results after these 2 years in terms of policy development, in terms of capacity building, in terms of understanding what is the main communication contents we have to work in order to operate this change, which is so crucial for the various outcomes that we are trying to improve. So this is a very brief presentation of the project, the partners, and the main content. I think now we can have a very short presentation of each of us.
Indeed. That's what I was also planning to invite all colleagues that are with us today, as it will be a discussion. It's a closed meeting, so it's more of a technical discussion that we plan to have, bringing expertise from each of you. Very briefly, as there will be opportunities for us to hear all of you later on in the discussions, just the name, the position, and the expertise that you bring to the discussion today. So really very briefly, I will just name, because I think otherwise it will be perhaps difficult to follow and to make the best use of time. Maddalena, please go ahead.
Yeah, good afternoon, everybody. Thank you for having me here. I'm Maddalena Cannito. I work at the Scuola Normale Superiore in Italy, and I'm an expert in the field of fatherhood and especially paternity and parental leave. So I did for a long time, and I'm still doing researches on this in this field, and I'm very happy to be here to share our knowledge and our, I hope, expertise. And thank you again also for the organization.
Thank you, Maddalena. Also, Anina, you're on mute, Anina.
Microphone.
Yes, put it on.
Yes. I'm Anina Labuk. I worked for several decades in international aid and mainly with the UN as a gender advisor as part of a retirement project. I was part of the coordination of the previous parent project and currently this 4E parent as a consultant with CSB, working with Giorgio.
Thank you, Anina. We move ahead. Tatiana.
Okay, thank you. So Tatiana Moura, based in Portugal. I'm a researcher at the Center for Social Studies and the coordinator of the Observatory on Masculinities. I coordinated the previous parent project, and I really appreciate to be included in this new Pori Parent project that is the continuity of what we've created some years ago. So thank you for the organization, and to Isa also for inviting me.
Thank you, Tatiana. Aicha?
Hello, everyone. I'm a junior program manager at ISA. I'm very happy to have you here. I hope we will have a productive meeting on engagement and fatherhood, and Mihaela will also give more insight at the end about our work as well, a little bit.
Thank you. I see Francesco Belletti.
Good morning, and thanks for the invitation. I am a sociologist, the director of a research center named the International Center for Family Studies in Milan, Italy. And I worked also on parental role and family relations. I've been a father, I'm still a father, and also a grandfather.
Thank you so much. So many perspectives in one person. I'm moving ahead. I'm afraid that I will not know exactly perhaps the name Fidalgo, just to be sure that I'm not misspelling something.
Hi, I'm working in the Commission for the Labor and Employment in Portugal. It was an equality body in Portugal, and I coordinate the project and the training about the equality, gender equality, and different topics.
And a very close partner.
Yeah,
from the
you.
government to us.
thank you, Tatiana.
Thank you again. Very good to have different perspectives brought into the discussion. Mara Marcela, please.
Hi, everybody. My name is Mara. I am a sociologist. I work at Deep Blue, and I will lead the task about social media listening and analysis. So very happy to be here with these experts, and thank you for bringing us together to discuss.
Thank you for participating, yes, and for bringing your views also. Jan Martin from Belgium, please.
Good afternoon, everybody. Can everybody hear me? Because my internet is not stable. Okay, perfect. I'm based in Belgium. I have two tasks in this organization. One task is to coordinate our father group. We have father group since 2009. In Belgium, it's very rare. I think they're all total or 3 or 4 other organizations in Belgium who work with father groups. And then the other part of my job is to coordinate a learning network who brings organizations together in Belgium who want to work with fathers, who want more information about it. And it's a network from around 100 partners at this moment.
Wow, thank you. Looking forward also to have your input in the discussions. Miguel Lazaro, please.
Hello, everybody. I'm Miguel I live in Madrid. I'm vice president of a small association that we called Masculinidades Beta. We are here in Spain, and well, I'm very involved in creating networks. You know, I'm part of the Men Engage Europe Steering Committee, and here in Spain and Portugal, we created a few years ago the Men Engage Iberia network with Tatiana and other colleagues. We are now 14 organizations here in Spain and Portugal. I'm very happy to share with you what is the situation in Spain and what are the policy discourses about masculinities and fatherhood and men and engaging men in gender equality. A very interesting topic. Thank you.
Looking forward to it. Moving ahead, Elena Lloberas.
Hello, good afternoon. I'm Elena Lloberas. I'm a clinical psychologist. I have experience working on early childhood centers here in Barcelona, in Spain. And I also work in the Blanquerna, that it's a university here in Barcelona, that we are coordinating the Father Rock project that began more than 1 year ago, where Anina is also an advisory board member. Well, Berta was to be here today, but she couldn't assist. I will be here, like, contributing as much as I can. I work in this project as a researcher, helping to design the capacity building programs, evaluations, and many other things, and also as a project manager.
Wonderful. Thank you, Elena. Moving forward, Angela Giusti.
Hi, hello to everyone. I'm Angela Giusti. I'm a senior researcher at the National Institute of Health, and I'm the the Furry Parent project coordinator. And my area of expertise are the first 1,000 days of life, with a specific expertise in breastfeeding, protection, promotion, and support. And I'm also the director of the WHO Collaborating Center for Childhood Obesity. Thank you for organizing this workshop.
We're happy to do it. We move ahead. Chiara Saraceno. We don't hear you. You're still on mute. Could you unmute yourself? Oh, yes. It happens. Yes.
Chiara Saraceno, I am a sociologist, old sociologist. I am a co-coordinator of Alleanza per l'Infanzia, of which also Giorgio Tamburlini is a member of, and I study the family and gender relations since many, many decades.
Looking forward to have your valuable input also. We're moving ahead. Thank you. Linisha Pereira. Not yet. Okay. Tiago Rolino.
Hello. How are you? Sorry I'm late, but I was like really focused in doing other things. I forgot the time.
So just briefly introducing yourself.
Yes, I'm a researcher and a research manager here in SES. I work with Tatiana and with Rosario in another project that she's here also. And I have worked with Anina in Parent also. So my field of research and field of work is the gender equality with focus on masculinities. Nice to meet you all.
Nice to meet you also. Thank you, Tiago. We'll hear now from Paola Scardetta.
Good morning to everybody. I'm Paola Scardetta. I am a researcher at the Italian National Institute of Health, and I work with Angela Giusti and other colleagues in this project for a parent. Have a good job.
Thank you, Paola. Monia Torre.
Good afternoon. I'm Monia Torre. I'm a scientific communicator working at Zadig Agency, and with Eva Benelli and Emily Saltorelli, who cannot join today. So I will do my best. And Zadig cares the communication and learning part of the project. And thanks to let me join.
Thank you very much, Monia. We'll hear now from Armela.
Yeah. Hello everyone. I'm Armela Pengili, CEO of Act for Society, based in Tirana in Albania, and a researcher on parenting positive. Even on gender equality, we are part of Men Engage Europe, and I would love to hear what is going around, because we have different type of parenting styles and model and positive, and it's very interesting what you have done, and I would love even to share here in my country. Thank you.
Thank you so much. I hope I didn't miss anybody. Or if I did, please, this is the moment.
You missed me. I'm Nicole Biscotto.
Nicole, okay, sorry. It's yeah.
No, don't worry. It's not a problem also because I will be mainly listening today because I'm a chemist. So as you can see, my expertise, my background is not very in line with but I'm involved in the Furry Parent project with my colleague Mara. So it's good for me to learn from you.
Okay, thank you, Nicole. Well, with this round presentation, I think that we are ready to kick off the discussions. And I was mentioning at the very beginning of the introduction that I'm just going to give a brief, very brief presentation that will set the discussion on, and then we will dive into the first panel discussion. So I think I will do it because since you cannot have the full screen, I think it's a bit difficult for colleagues to see. So yeah, I hope that everybody can see it, and I will put it soon on a full screen. Does it work well? So why engaging fathers matter? Well, the term father, we know that it's a term that carries several assumptions. And I think that there are a lot of changing family structures nowadays. So I think that we should be very careful on what do we mean when we say fatherhood and father involvement. According to American Association of Pediatrics, the guideline on fathers, the father is defined broadly as the male or male identified as most involved in caregiving and committed to the well-being of the child, regardless of the living situation, marital status, or biological relation. And by that, we mean that alongside biological father, the definition includes also foster fathers, stepfathers, and grandfathers. But more important is, like, as we said at the very beginning, one of the strongest rationale for which we are talking about men and fatherhood. There are many arguments and rationales behind supporting the idea of having them involved in the caring responsibilities. But one that carries us the most in the discussion is child's well-being and development, holistic development, and fathers and men play an important role in this. And with the launch of the Nurturing Care Framework in 2018, that was talking about all these 5 areas of policy and programs and practices, we started understanding how important in all of this fathers can play a role. But also when we talk about responsive caregiving, how well equipped are fathers to be the ones that provide this kind of responsive caregiving, but also to what extent they are sharing this responsibility with the other partner in the family. So how do we ensure that children do benefit of everything that surrounds them in the home environment by having both partners involved in their development and stimulating equally their development? Well, the nurturing care is a very important framework for guiding our thinking around children. But to what extent parents, and I'm talking about mothers and fathers equally, and all those that are surrounding the child, females or males in child's life, are aware of the role that they play in providing that nurturing care. And they can provide their involvement can take different forms. And that's what also the 4E Parent actually project is about, to bring that awareness that there is perhaps limited understanding on how they can be involved. But they are the ones who can be part of providing the nurturing caregiving. Well, to foster the child's psychological and physical well-being, that's one part that definitely can make a difference in a child's life, and also to support and increase their academic achievement, being that in the early years through stimulating their learning, but also later in their school performance. And we know this is something that to a great extent, I would say that some of the parts of this knowledge is penetrated the culture of upbringing and being part of the child's development. However, there is an unequal distribution of tasks, responsibilities, and levels of involvement and commitment. Well, there is obviously, there are many benefits and the evidence, and I said we are going to browse around the evidence. There's been a quite concerted effort around bringing more evidence on why fathers are important, why men are important in the child's period of development in the early years. And if we look at how different types of benefits are surrounding the topic of fatherhood and men involvement, there should be no discussion why we should not further support any initiative of policy that can bring them closer and sustain their involvement and commitment. One benefit we definitely, and they are layered benefits. One that stays definitely for the child development, and there's already evidence that this leads to better developmental outcomes for children. And when I said developmental, it's all kinds of outcomes. at different areas of development of the child. It seems that they are more likely that females get medical access in emergencies and birth complications if fathers are there and they are involved. That the father's hormonal and cerebral changes are happening in responding to baby's signal. So that's an interaction, a bond and interaction unique that favors fathers, particularly, equally children, but also that determines changes for fathers. It seems that more healthy lifestyles are adopted by men if they are fully involved in caring responsibilities and committed to them. Men and women's well-being and life satisfaction as an individual, each of them, and as a couple, is increasing. Less likely is for women to have postpartum depression. There is a reduction of physical punishment and sexual abuse and domestic violence in families. Obviously, there's an empowerment of women and their participation in labor market. And there's a lot of gender equality mainstreaming in the society, which brings more coherence between the individuals. So there are so many and so different and of different intensities, but also for so many males, females, different age groups that can benefit from this, from one change that should happen in our societies. Well, to what extent that can happen, it's something that it's for us to see how we can make it happen. And I'm just, as I said, it was just a really brief introduction to set the stage for the discussions. What we want to learn now is why, and now we will hear more perspectives from countries. How is this issue perceived in Italy, Spain, Portugal? And we were talking we want to set the narrative right and to get it across different stakeholders in the society. And we saw in the 40 parent that there are different categories of stakeholders that are targeted. It's not just about the parents and the professionals, but there are also the policymakers and decision makers that need to be part of the narrative and support such kind of enablers for bringing the culture of fatherhood and men involvement. So I will invite now our colleagues in the panel. I'm going to have Giorgio Tamburlini, Tatiana Moura, and Miguel Lazaro, each of them representing Italy, Portugal, and Spain, to just talk a little bit about if there is the right evidence there in the country, if it's well known, by whom is well known, and how what we should do to make this evidence better known. So question, is it there? Is it something that, it's kind of in the professional culture, not to say in the broader audience, but in general, is this a topic that is well streamed in the professional discussions for those that are working with children and parents? If not, or yes, we will go later, what should we do about it? But if the evidence is known, by whom? Who are the ones that are, holding the power over the knowledge? And if it's made known, who is making it known? Is it in the pre-service, in-service? Is it in the decision-making bodies or not? Where do they sit? In what sector also? Is it more in the health sector than in the education? Or is there any discussion around this issue? In what fora? Let's put it this way. So I know I've put many questions, and we just need to know briefly, what is the situation in all these countries? Yes, about the narrative that talks about why fathers and men matter in the child's development. So I will start with Giorgio, if he doesn't mind. And I will stop sharing my screen now and just bring some input into this discussion now from the Italian perspective, Giorgio. If you unmute yourself, it will be fantastic.
Here I am. Yeah, I think we have to make a couple of steps behind in this discussion and say that even before discussing about the father's involvement, in Italy, I think it is not only in Italy, but in Italy it's quite evident that the whole role of responsive caregiving is not yet well understood. Even most of the educators, for example, still think that with an appropriate and quality intervention in daycare, they can do a lot for the development of the child. And still the role of what happens in the family environment is underestimated. So this is true for the mothers and of course for the fathers. Let's say that the role of the mother is in a way given for granted everywhere, anywhere, without getting into the details of what exactly happens between the mothers and children, while for the fathers is considered as not particularly relevant. I say this because we still have to insist about the general importance of responsive caregiving, and within this to underline the specific role of the father. What is maybe interesting in the development we have seen in Italy over the last years is that for sure we are witnessing an increasing proportion of fathers that are involved quite early, and they do their best, although this is an elite which is not necessarily an economic elite, because today many young parents are, let's say, very well educated and very well aware, but they don't live in an easy financial situation. But as I said, this is still an elite. But in spite of the fact of this being an elite, I think the society as a whole is ahead, even let alone the policymakers. I will speak about those later on, but is ahead in some way of the professionals. For example, health professionals, with of course some exceptions, are very little engaged in promoting, facilitating, but even in understanding what can be the importance of the early engagement of the father. Some exceptions are concerning probably some of the professionals working around the maternities and the neonatology units. But as far as, for example, the family pediatrician, which could play a crucial role in Italy, I would say that a small minority of them is aware of what they could do and what they should do, with the authoritative opinion that they can have and they still have in front of the families. The situation of the educators is slightly better in terms that many of them, or some of them, have tried to engage in a more in a stronger way in facilitating the participation of fathers. We have, just as part of the project, together with Anina and others, started to have some focus groups, some discussion with group of educators, and some of them, although I understand they have been, in a way, they represent a selected part of the population of educators, they have shown awareness and in some instances also good initiatives in terms of trying to involve fathers. I still think that the strongest part of the narrative is that regarding the benefits for the child. This project is focusing, in fact, on the first years. One thing which is not at all clear, and we have to insist on this, is that early engagement matters. And you have, Michaela, you have underlined a couple of, scientific evidence that we have on that. And I think we have to insist on that. What the difference which is made by the early engagement, because even fathers are subject to, let's say, early influence of what they do. And that is extremely interesting. I think what we miss, although those of us who are researchers and scientists should not think that the evidence is only the one that you produce in your own environment. I mean, if a research is done in UK, I'm ready to take the results of what is done in UK. But the general public, and even more the policymakers, do not have this logic. So one thing we are missing in some results from our own country, and I'm asking to my colleagues whether this is true for other countries too. For example, in terms of early inequalities, when we have shown in research done 4 years ago together with Save the Children that at 4 years children are already quite unequal, that has made a difference, because the research was done in Italy on Italian children in well-recognizable Italian cities and neighborhoods. So this is one thing we have to try to put together as much evidence, and I'm sure there is evidence, because you go through, let's say, doctoral theses rather than, surveys made even at a small scale. I'm sure we can find some evidence which is locally relevant. And I'm saying again, this is not, this is not a scientist perspective. It's just to get the key concept, mainstream in general public and policymakers. We need some local evidence. Another observation which I would like to make, which is rather obvious, that the narrative is to be, in a way, adapted to the target audience. For example, a health professional would like to hear some kind of theory of change, of evidence behind this. Educators may be interested in other aspects. Policymakers also, so probably we will have to have some discussion about how to present the narrative to different audiences. And I think the work that Deep Blue will be doing in trying to understand what goes in the social networks will be very important in order to see what are the direction that we have to make. Another interesting point, but I'm sure that Maddalena can expand on this, is the fact that since we have started to work with companies, private companies, we are discovering an interest which is much much wider than expected, at least by me. Probably because of the fact that some companies really want to invest in the welfare of their employees. Maybe also because some companies are interested in achieve this recognition certification that have some, some implication, also fiscal implication and so on, becoming corporate B or whatever this, kind of certification. But companies and in general civil society in Italy seems to be a little bit ahead even of professionals, let alone policymakers. So these are my first consideration. I will leave the floor to others. And I hope this discussion opens our mind and
Thank you, Giorgio. Yes, I think that if I can just summarize a little bit, there might be evidence there, might not necessarily be from Italy, but still it did not, let's say, penetrate all the professions in terms of the awareness, understanding, and then even embracing practices that are aligned with what the evidence is saying. This is one thing. Secondly, that while the evidence might be there, we did not yet do a good job in building a narrative that is enough persuasive so that it can reach out to those stakeholders that can either act upon, but also make the right decisions of encouraging those kind of programs, initiatives, policies that can make a difference. So I will just continue now then the discussion with Tatiana and just to see what's the perspective coming from Portugal. So is there because I think that it is important if whatever evidence, that one that I mentioned, but I'm pretty sure that we can really come with a lot of other evidence that can be presented. To what extent is part of the preparation of the professionals? Because if we want to encourage men and fatherhood, it's obviously that those that are working in services interacting, and health services, yes, are perhaps amongst the first ones, but not necessarily always. If they are to encourage or sustain such kind of approach, then they should be the ones that are the most aware about it and see a reason and see a meaning in it. So to what extent this is happening in Portugal, Tatiana?
Okay, so
what's the narrative there?
What's
there
the narrative? Is there?
Yes,
that's correct. You know that I'm a very attentive student and pupil, so I wrote the answers to the two questions Aisha sent me, and that I will share with you the pages that I wrote after this. Of course, we're going to repeat ourselves because we have some sort of the same conclusions, but I tried to sum up the lessons learned from the parent project and the kinder project from a feminist perspective. So I would say that, is there any narrative? So the first answer is yes. And I think the feminist movement is quite aware of that. And that includes the Commission for Equality on Labor and Employment, with Rosario representing here, the Commission for Gender Equality also, this is at the state level. But in terms of, the global approach, if we convince capitalism that engaging men in multiple levels of, in multiple levels, I think we will win. So that's impossible to convince capitalism that engaging men is a good, is a good deal. So let me just open my notes here, because getting the narrative right and getting it across. So the experiences from Portugal. So engaging fathers is crucial for several reasons. And from our perspective, the first of all is because it promotes gender equality. You already mentioned, Mihail, in the beginning, of course. Then it promotes child development, of course, and we need to insist in the first 1,000 days of life, because we have some research and some programs implemented or being implemented after 3 years old, and we need to go a little beyond that. So, of course, engaging fathers also contributes to emotional connection. You already mentioned that. One thing that can influence the narrative is the role modeling. So you defined quite well what a father is. It's not only biological, but they serve as important as role models for their children, especially boys, if we focus on masculinities and developing non-violent and empathetic masculinities, because we know that when fathers are actively involved, and we know this for several years, they demonstrate positive behaviors and values such as empathy, respect, and responsibility. And this modeling, not only from or by biological fathers, helps to shape children's attitudes, beliefs, and behaviors. And we have data from Portugal on that. And of course, promotes the foundation for healthy relationships and positive masculinity. And when we talk about role modeling, we also talk about engaging men that represent those models, like, for example, in sports. So sports and trainers, they are sometimes the role model a children has. Shared parenting, of course, engaging fathers promotes shared parenting, where both parents collaborate in decision-making, in child-rearing responsibilities. Shared parenting reduces the burden on mothers, especially during COVID and after COVID. We know what happened, allowing them to pursue other aspects of their lives and careers that we know we kind of went through a backlash on that in lots of different sectors. And it also enables fathers to develop their parenting skills, leading to more involved and capable specificities of caregivers and strengthening connections with children. In case of Portugal, getting the narrative right and getting it across is important by, first of all, challenging traditional cultural norms that I believe we also share with Spain and Italy, and societal expectations regarding gender roles. So by highlighting the benefits of engaging fathers and promoting their involvement in parenting, Portugal, as well as other countries, can foster a more equal and inclusive society. So this is the perspective that we work from. And this can be achieved, or at least we can try to achieve, through awareness campaigns, policy initiatives, and support networks that encourage fathers to actively participate in childcare and household responsibilities. Education and workplace policies are crucial and play a significant role in enabling fathers to balance work and family life effectively. We are just going to, this is the last month of the Kinder Project, and we did a lot of research with educators from kindergartens, and we still have cases like the letters that the kid takes home. They are directed at mothers. So dear mother. So we can start by the basics, or the colors, the pink and the blue. No knowledge at all about gender equality, about the importance of breaking stereotypes and deconstructing stereotypes. So I would say education is quite important. So some of the strategies I kind of summarize may be applicable when targeting different sectors and groups, including politicians, professionals, fathers and mothers, and employers that Giorgio already mentioned. So regarding politicians, we learned that we need to emphasize the social benefits. So highlight how father engagement or man engagement contributes to social development, gender equality, and the overall well-being of families, and emphasize how policies promoting father involvement can lead to positive outcomes for children, for families, and for communities in general. Also connect with policy objectives. That's what we did with parent, and that's what we did under Kinder, and also with Igual Pro, the project that we have with SIT. Frame father engagement as aligned with broader policy goals, such as family-friendly policies. In Portugal, for example, we have, and Nina knows quite well, the impact program. It's the initiative for the engagement of committed fathers. It's an initiative from the health sector, and it was starting when the parent project was starting. So we immediately made a formal partnership, and our parent manual in Portugal is their training toolkit. So engage with already family-friendly policies that exist, or gender equality initiatives, like from the Commission for Gender Equality, from the Commission for Equality in Labor and Employment, and early childhood development strategies, like nursing schools, universities, etc. And show how supporting involved fatherhood aligns with political priorities, even if they don't call it that. Also, build joint projects from the very beginning, the way we did. So don't invite them in the middle of the project for politicians. Just invite them before writing the proposal. This makes them feel engaged and accountable for the results and implementing of the process. Regarding professionals, I totally agree with Giorgio. So we need to present research-based evidence, even if it's not from our country, because sometimes we don't have the funds to do our own survey, but start by using the studies that already exist. And if we have funds, we carry our own research, because professionals, they need to look at findings to understand or to understand the obvious. Also, for professionals, offer training and resources. We understood, especially for under kinder, that professionals have no tools at all, no training, no resources to support them in promoting fathers' engagement or promoting the deconstruction of stereotypes, for example. Educators from kindergarten and preschools, they were very interested, but they had no tools at all. We don't need to convince mothers to highlight the shared benefits. I think they already know. We need to explain that they are also accountable for challenging stereotypes, I'd say. And in terms of employers, the same, promotes what we've been doing, especially with Equimundo, to promote work-life balance, showcase the benefits of work-life balance, showing that fathers that stay at home, they in the end, they reduce absenteeism, they are happier, etc., etc. So they will contribute to the benefits of the private sector. And also share success stories from our experience in parent and kinder, showing success stories work better. It's a better way of communicate the benefits of engaging men, and especially fathers, than other sort of initiatives. So I think all these advocacy, in all these advocacy efforts, it is important to use clear and compelling messaging that resonates with each target group. I know, just 30 seconds. And I think we need, it's mandatory to tailor the messaging to address specific concerns, priorities, and values. And the last thing that I want to underline is that from a researcher point of view, we've been saying lots of times, and especially coming from the war and peace studies field, in my case, in sociology, that the opposite of violence is not non-violence, is care, and especially nurturing care. So by promoting nurturing care, we can prevent violence at every levels, including at the war level. So this is a sort of thing that I think that resonates a lot, putting care in the center of the research and the debates. Thank you, and sorry for going beyond my time.
Thank you, Tatiana. I know that sometimes it's hard to stop yourself because you're so passionate and you've been working for so long, also on and being engaged in many multi-country efforts and global ones. So I think that what you've presented, the kind of it contrasts a little bit what Giorgio presented about Italy, because I think that you have done a bit more steps ahead in from what you're presenting. On the other hand, the message is the same. We might have evidence, but we need to be very careful to whom we are communicating, how we are communicating, so that they become sensitive and embrace the perspective of equal involvement or shared responsibility and commitment. There are different narratives. It's like, how do we get the narrative right? I think do we get the narratives right? So I think that's a challenge perhaps that as researchers also we might have. Producing evidence is a good and important step, but then how this evidence is communicated further, to whom and how, and by whom also. So what's the message, what's the messenger? I think all of them are equally important. I think in the discussion that, because that's the purpose of the discussion today, communication and advocacy issues, I think that we've already had a lot of food for thought from the two presentations. We are running late, I'm quite aware of that, and we will do our best to keep it in a reasonable manner, the discussion. I will invite now to see what's happening in Spain. Is the narrative there? Is it the right narrative? Is it enough evidence feeding the narrative? And how is, if it gets through to which of the stakeholders? Let's hear from you, Miguel. Thank you.
Thank you, Michaela. Well, situation is very similar to what Giorgio and Tatiana have described. In Spain, there is really a lack of awareness not only between men and fathers, but as well between like women and mothers, but of course, and this is a big problem, between care professionals, policymakers, and so on. I have prepared like a very short presentation, which I will use the opportunity just like to explain what is the situation and what are like the main. Yeah, you can see it, right?
Yes.
Okay.
Please go ahead.
Thank you. Yeah. Well, just because it was last Sunday, it was like Father's Day in Latin America. I just saw this. Well, these are like the days that are enjoying in the different countries in Central and Southern America. You see, like, I mean, like only 2 days in Argentina, for example, 5 days in Chile. I think somehow like we are a step ahead here in Europe, but here, like in Spain, we are enjoying, like fathers can enjoy up to 16 weeks of parental leave. And one thing that I always say, it is like, this is a right fathers enjoy, but they didn't actually fight for it. It was like the feminist movement who were actually like fighting to increase this parental leave that is now like in up to 16 weeks. It has evolved very quickly. Like in only 15 years ago, in 2007, in Spain it was only like 2 days. You only had like 2 working days to, like, you know, like go to the registry, and that was it. But it went like it went like increasing from 2007 to 2 weeks, and now we have like 16 weeks. The process has been like, it has gone like slowly increasing, and now the situation is like both mother and father, they have like 6 compulsory weeks. Both of them, they have to take these 6 weeks, and there is afterwards this 10-week voluntary paternity and maternity leave. This is the situation we have now in Spain, but the lobby that was actually like fighting for this, which is called this like PINA, they are very critical with this settlement of the parental leave, because they say that they are saying this like 76% of fathers took the 16 weeks in a row and simultaneously with the mother, when actually what they were claiming, it was like we want men or fathers to be taking care by themselves alone with the children, and like for them to get really to train their caring capabilities and to to engage with the baby, with the creature, and to just like to be autonomous. And so they are lobbying again, like just to reduce the paternity leave, the compulsory period only to 2 weeks, and then allow another 14 weeks for the father to be with the baby, and having the couple or the family unit having the opportunity to arrange these weeks the better way, like for the baby to be the longest with the father or the mother. There is as well a big problem because according to the law, the father must negotiate, must agree with the employer when is he taking these 10 weeks of paternity leave, of voluntary paternity leave. This is something like problematic because many fathers, they are not in a strong position to negotiate with employer about when taking these weeks, or even like reducing the working hours, having like reduced working hours to spend more time with the baby. And at the end, like all these gender imbalances, like we are not really having the impact we could have with these measures. Just for you to know, this PINA has as well this international platform, what they call PLENT, that probably you know already, and they are like, let's say, trying to export their proposals about this non-transferable, equal in length for both parents, and 100% paid leave. And just like very recently, since 2021, after the COVID, the central government issued this Plan Corresponsables, which is like the first state-level public policy that includes activities and actions aimed at men. And they actually like include a budget line. They force the public authorities, I mean the municipalities and the regional governments, to spend a minimum of 3% of the budget on training men on co-responsibility, which is something that I really don't know how you train men on co-responsibility. It's like either you train men on caring capabilities, or I don't know, or emotional processes or whatever, but actually like, well, it's like training men on co-responsibility, and this is something like very difficult, not only for us, but as well for the public bodies, that they actually don't know how to do it, because they are like trying to engage men and fathers on these trainings, but it's like they are not. I mean, if it was at least like cooking trainings or housekeeping trainings, I think this would be much more useful than just like having like men come here, we are going to tell you what you should do, but actually you are not giving them really like increasing their capabilities or their capacities, that you need men to do that, and you really need men to question their mindsets about what is masculinity, what is fatherhood, and this is still something that we are lacking. Just one last word that maybe we can go further on that. Here in Spain, we have this, well, political situation is really messy. We had elections a few weeks ago. We had regional elections, and one work I'm doing is going through the political parties, through the programs of the political parties here in Spain, looking for proposals of policies aimed at men and masculinities. And well, it is a very identity-based feminist policy, let's say. It's a lot of measures and proposals for women and for the situation of women and everything, but there is nothing really like, or almost nothing targeting men. And somehow now we have this debate because we're having the general election in July, the backlash, all these like men that they don't feel included in the feminist or the equality policies. And this is really tricky because actually they are not included. I mean, we can discuss later if gender equality policies, it is the field where we should include men's, or I mean, men's needs, or maybe we should do it in health policy, in social policies or other fields, not in equality field. But I think there is a huge gap there because, like, you know, it's like the intelligentsia of the country, the political actors, they really don't think on how to engage men. You know, it's like we are considering men usually as potential aggressors or as privileged group of people, but we are not considering the special or specific needs of men. And I think this is a huge problem, and it's creating a lot of sense of, a big backlash. Yeah, sorry for being so.
For nothing, I think that this is an open discussion, and I think that's the main point of having this workshop, of bringing different perspectives and insights into the dynamics in each of the countries, and to see, you know, what's the discussion out there. So how is this topic perceived, and to what, where is it dominant, where it does not exist at all, and which are the places where we should start strengthening this narrative and to put it in the right direction. I think that's also another, is not to have only the right narratives, as I said, but also to have it in the right way put, because I think that there could be different shifting powers in this discussion around this topic. And we need to, by answering just to your question, if it should be here or here or here or here, I think it should be everywhere. It's only, again, to have it in the right way and not to be instrumentalized in the directions that actually are sabotaging the rationale for which we have actually started promoting man and fatherhood involvement. It's a complex issue. It's not a simple, there's no recipe. There's not one way that it works everywhere. I think it's because the country contexts are so important, but still that doesn't mean that we cannot learn or bring insights or strategies or tactics that can work in other countries. So I think that's the main reason for which we are actually having this workshop too, to be more aware where we are, where we sit, how does it happen, how did they get there, you know, how did they do that, and how we can learn from it. I'm constantly looking at the time because it's becoming our enemy. And while we initially said we want to have a discussion, I just don't want us, just the panelists and myself, to talk, but rather to have the others also involved. I will just give like really quick reactions to what has been heard so far, and like have at least two or three colleagues, if they have any kind of, you know, top reflection or reaction to what has been said in terms of how we can strengthen the narrative, how we can really put it in the right direction. What did we learn from these 3 country experiences? Where do we sit with the building narrative around fatherhood and men involvement? If there is any reaction, if not, I'm not pushing for it. I just was wondering, just by listening. If anybody wants to, just raise your hand. What we have heard and what I can certainly hear, I very much appreciated that in different perspective brought policy-wise, engaging private companies. So there's an employment entire space and environment that can be supportive. Professionals that can be also gatekeepers of practices that are not encouraging manhood and caring responsibility. They're all equally important because they can converge or not. Either is converging effort policy-wise and practice-wise, either they're pulling in different directions, and that annuls the efforts that we are doing. So it's not going to be one solution. Anina, I see your hand up.
Is there nobody else? Because I'd rather it was somebody
Not yet.
else. No. Okay, so very quickly, I found what Miguel said very interesting, a bit worrisome. We have already had a political change, and so we're already confronting some of these issues. And again, I found it a little bit depressing, but that's not unfamiliar, that the issue about, you know, shared care and father's involvement is very often led by women. And this is something we really need to get away from. I found it was interesting listening to the three of you, because we had, okay, more a sort of child-focused dimension from Giorgio, although he interestingly said, look, there's a bigger issue behind this, which is a lack of understanding of, you know, the need for responsive parenting, irrespective of mother-father. Then there was the feminist perspective coming from Tatiana and the focus on men. And I was reminded of the fact that we're all, in a way, the children, the parent projects are the children of men care, which has this very integrated framework where those dimensions, the child development, the feminist angle, the violence prevention, the masculinities, are all together. And I think, Michaela, you were mentioning this, we need to hold all these things together. It's tremendously important, because like with the men, yeah, there are some very active group of men, but they're the wrong kind of active groups of men. We have these in Italy. They're often, you know, the separated fathers, the angry fathers. So it's very important that you keep the gender equality, the co-parenting perspective always into this picture. And on the gender equality, I just wanted to say, I mean, one of the much debated issues now at the moment, especially from certain political quarters, is the fertility issue. Now, there isn't a direct link between, say, you know, increased father's leave and fertility, but there's definitely a link between increased women's employment and increased fertility, and greater father's engagement is conducive to higher female employment. So I think we need to bring in that angle, and I think the evidence is there. Maybe Chiara can tell us more later, because she's been doing work on this particular topic. And I see Angela now. Yes.
Yes, Angela, go ahead. Thank you, Anina, for all these insights. Yeah.
Thank you. Just, you know, I have a very small perspective, but I know profoundly the health sector. So from this perspective, I think, at least in Italy, but I think is the same in several countries around Europe. We had a problem in the last years of not involving, or let's say excluding, the fathers from pregnancy and childbirth and the care of the baby, especially during the first months. And the COVID has I don't know if it's English, exacerbated, no.
Yes, it is.
Exacerbated it, because the COVID has been taken by the health sector as a pretext to leave fathers and all the rest of the family out of the hospital during childbirth. And we have published a lot of studies with really the dramatic experience of women left alone in the hospital and fathers left alone in the hospital parking. And we are publishing now an article where we can demonstrate that the level of the involvement of fathers in the hospital during childbirth has never recuperated what was before the COVID pandemic. Kind of, now that they are outside, let's leave them outside. I mean, I know what were the reason during the COVID pandemic. We were there. So we know that it was, especially in the beginning, there was no evidence. So it was really a life-threatening issue. And I can understand during the first wave of pandemic, but then we had the evidence and it was not anymore justified. So this is one of the perspective from the health sector. So involve the father, or let's say do not exclude the father, do not actively exclude the fathers as we are doing now. And I will not say all the reason why, from the ethic perspective to the right perspective of the child, of the father and the mother. And then there is another question that is more tricky, in my opinion, when it's about the rights and when we speak about gender equality and gender equity, because I've been a midwife in my previous life, so I know very well childbirth, and I consider myself a feminist, but men and women are not the same when it's about biology and childbirth. So we have a recommendation. This is something we are discussing a lot in Italy, and I found also that it's very interesting to try to find kind of win-win solution where everyone can find its own its own perspective that is respected, etc. But I give you the example of Italy. You know, we have recommendation worldwide to breastfeed for 6 months, exclusive breastfeeding for 6 months. And women in Italy get only 6 months of maternal leave, pregnancy and after childbirth included. It means they don't have enough time to be compliant if they want breastfeed. Of course, it's not an obligation, but it should be allowed by the law if you want to. And at the moment in Italy, it's not possible. So when everyone was saying, hurrah, hurrah, let's see Spain, let's do the same, 4 months for the father, 4 months for the mother, I was a kind of, I was troubled because it's losing the rights. It's really 3 seconds. You have to be there to presidiare. I don't know. I'm sorry. I'm tired. I'm going to holiday in the next day, so my English today is not so good. But you have to be there to be the gatekeeper of the right or women's rights. So now the thing in Italy is that anyway we don't have the money for equal parental leaves, father and mother leaves. But I hope one day we will have the money, and then we will be there again to discuss, should be the father and mother leaves equal in a perspective of equality or of equity. Equity meaning that everyone needs according to its own needs. And I think that women still need more attention during the childbirth process. In the ideal world, we give 1 year, 12 months parental leave, 100% salary, and everyone will be happy, of course, but we are not in this kind of ideal world. So it was just to give another perspective. And I conclude by saying that our Norwegian colleagues say that when it's about caring for babies, women stop working. And they have, I think they have 8 months for mother and father, but the care of the child goes beyond, and breastfeeding goes beyond 1 year of life. So it's part of the complexity Michaela was saying.
Exactly, and I think that's where the contradictions sometimes are coming when conflicting agendas are talking about this issue, and that's why we never find the end of the discussion, or there always be parties that are not satisfied with the result of every negotiation. So I think that that's why this whole discussion is like, what should be the driving narrative, or should we change the narrative depending on whom we are talking with? I think it's really important, the part on the communication and advocacy, for this reason, because there are many interests from different groups of stakeholders around this issue. And not all of them are aligned in the way that they understand the importance of fatherhood and man in the child's life. So if there will be a starting point, and the main rationale would be children, then perhaps we will get somewhere else. But not everybody has this agenda. It's us proposing this agenda, but not forever. So we're coming back to what Giorgio was saying. If we get the discourse starting from the importance of early years, the importance of responsive caregiving, and then we get to the importance of having mothers and fathers equally involved, then it's a journey in developing a narrative that I think countries are in different places. In some countries, the agenda of gender equality is more advanced, and it's not because of the child benefits. Just to be clear, it's of different other rationales. Not bad at all. But then we got the child perhaps lost in translation. So it's so important on how we phrase this narrative around, and they're intertwined. There are different narratives that are intertwined. The thing is that we are promoting specific approach to the issue because of child's benefits primarily, and linked with it many others. I'm really very sorry of not being able to discuss more, but I'm mindful of all our time, yes, all of us being here. And we are going to move to the second panel where we were proposing to have this discussion about enablers and hinderers, which could be of different natures, as all of us would agree upon, yes? And I will just now I would give the floor to Anina to be the one moderating this discussion with the colleagues from the 3 countries. Yes.
Okay, you can actually take this screen off. I don't think take this off. Yes. So. I'm going to jump straight in because we're already running half an hour late. But I don't think this is really bad, because actually I think many of the topics that were part of this second panel have already emerged. Because, you know, the issue is, okay, the evidence is there. The evidence is there, collected in various countries. It may have to be more country specific, but overall the evidence is there. But the gap between the evidence and what reality is actually quite big in all our countries. So what actually is preventing us from achieving that objective of greater engagement of men? And what are sort of the blocks of issues that we have? And so there's the cultural dimension. There's something that has to do with the way services are organized. It has to do with service culture. It has to do with the frontline staff. Let's take a look at what it is in the different countries that are actually where the main obstacles are, because that'll help us to identify our priorities on how we move ahead. So I would actually give the floor at once to Tatiana to start telling us. I'd like speakers, if possible, to stick to about 7 minutes, the 3 speakers, so we've got more time for discussion. And then if we don't have other participants who want to join, then of course you can come back and say more. So Tatiana, off with you.
Thank you, Anina. And I need to apologize because after my time, I need to leave because I just had a family issue, nothing to concern about, but I just need to leave, and I apologize to the colleagues for this. And I will also share, Anina and Mihaela and all the team, the text, the document that I wrote, so that you can keep it with you. So let's go through. First, let's focus on the enablers from Portugal. I think changing the gender roles and the funding that we now have and some initiatives that we have to change social attitudes towards gender roles, I think there's a greater acceptance of men taking on caregiving responsibilities. And this shift can encourage men and fathers to engage more actively in care by changing the gender roles in general. In the case of Portugal, our experience showed us that we need to take a top-down and a bottom-up approach, starting at very early ages. And this is the example of Kinder and why we developed this methodology, because of course, after Equiex, we found out that starting working with boys at the age of 12 was too late. And then we developed and we applied parent. And we worked with health professionals to start really, really early. So the second enabler would be supportive policies that Miguel already mentioned some of them. Angela already also shared some concerns regarding some of them. So in Portugal, we have several family-friendly policies in place to support fathers and encourage their involvement in care responsibilities. We have a program called Frontline that was approved on December 2018, for example, and it aims to promote a better balance between professional, personal, and family life as a condition for effective equality between men and women. And this program defines 33 measures that are essential tools to favor the reduction of absenteeism, the increase in productivity and talent retention, and also contributing to demographic sustainability. For example, an example of the collaborative and open spirit of this program is the Pact for Conciliation measure, a pilot project that will have the participation of 47 organizations between public services, bodies of the public administration, public companies, 11 municipal councils, and 15 private companies. So these adhering entities will commit and receive the stamp Giorgio was mentioning in the beginning. So this is this is followed very closely by the Commission for Equality in Work and Employment, also our parent. So the paternity leave in Portugal, we were the champions in Southern Europe. Now Spain is. Fathers are entitled to a paternity leave following the birth of the child. So now we have, since 2023, fathers are obliged to take 28 days instead of 20 of parental leave. So it is mandatory for fathers to take the parental leave of 28 working days consecutive or interpolated in the 6 weeks following the birth of the child. Then also we have the optional days that can be used consecutively or not, but always after the compulsory days. In the case of the birth of twins, the parents receive 2 working days of absence for each additional child. In addition to paternity leave, we have a good parental leave, meaning that it can be shared between both parents. Initial parental leave may last 120 days or 150 consecutive days. We have also extended parental leave and flexible working hours. And these flexible working hours, they were improved after the pandemics. Of course, some measures just came to stay. We have childcare subsidies, I think in the 3 countries. And one of the enablers for me is the education and awareness. And I think the schools and preschools, they need to overcome traditional stereotypes, because kids here, at least in Portugal, they spend at least 7 to 8 hours in school. And so they need to change these stereotypes. And what about the hinderers? Of course, traditional gender norms. We are a country next to Europe, in the south of Europe. Also, some workplace cultures, lacks of flexible work options, or being judged by peers. In Portugal, many fathers still do not take advantage of the right to parental leave exclusive to the father, because of many of them for reasons of pressure in the workplace, or fear of losing their jobs due to the time away from work, or even peer pressure from friends, so social pressure. Social stigma. Men who prioritize caregiving over work still face this kind of stigma. Economic factors already mentioned. Not everybody can benefit of this, because it's not 100% paid in the last couple of weeks. Lack of support networks is a hinderer, because insufficient support networks for fathers and limited access to parenting resources can make it challenging for men to navigate their caregiving roles. So that's why it is so important also to keep these groups, or at least institutionalize at the government level, the state level, with the health sector, some interaction and intervention with fathers. Early childhood education and care in Portugal can be an enabler, but at the same time a hinderer. So let me tell you why. Provision for children under 3 has a focus on childcare, while pre-primary education designed for older children is legally considered the first stage of basic education. So we have no offers for children under the age of 3, and that's something the government is trying to solve. So the recent measure was after the 1st September 2021. All children born after that will have the right to attend free nursery schools. So the measure came into force in September 2022. We still need to evaluate if it was effective or not. The early childhood education for children up to 3 years old is not part of the education system. It is the responsibility of the Ministry of Labor, Solidarity and Social Security. So up to age of 3, most of parents need to pay to have kids in creches or kindergartens. And finally, government changes. So we look at Spain, Miguel. We look at the example of Spain, and we know that the possibility of having the far-right government in Portugal can challenge all the achievements that we made till today in Portugal in terms of engaging men and promoting caring and nurturing masculinities. But, and just to, at the same time, it's a possibility of keeping the feminist agenda going without using the word gender feminism, gender equality. So if we focus on masculinities and fathers' engagement, even when we have a right-wing government or extreme right-wing, sometimes it works and it helps. It happened to us in Brazil with Bolsonaro. So that's it. Sorry for taking so long, Anina.
That was very interesting because, of course, what you say about men not actually taking advantage of the leave they have is an issue common more or less to all European countries. And actually, a lot of the leave issues also were some of the ones which Miguel already talked about. And I think here, the issue also is about work-related pressures, and I reckon that that's one of the reasons why fathers in Spain are taking the leave with their mothers, because this is convenient for the employers as well, because then they can have one of the two who is doing smart working, and surprise, surprise, it's probably the men doing more smart working than women. I mean, this is the sense. So I understand why Pina has those worries. Okay, Miguel.
Yeah, thank you, Nina. And actually, like very recently in a workshop we had in central Spain, in a small village, one woman was saying how in the local car repair shop, the owner, he was complaining that some of his workers took the parental leave and was absent for 16 weeks. So, and he was saying like, next time I will hire only men over 45 when they have already grown children. But this is a very good, I mean, this is a very good signal. Like the employers are as well like having to face men like putting the family or care in a more important place than their professional life. This is actually one of the things we want to change. Actually, well, thank you, Tatiana, for this positive last idea that you survived Bolsonaro in Brazil. So whatever happens, like we will survive here as well, and Italy you will do too. And well, I think, well, we need, well, this 16-week parental leave, I think this is an enable, like this changes things as this is silly example from this village, but I think these are things that are actually like happening. it is not that important, as they say from the PINA, they say it is not that important if the father takes the weeks and goes for holiday or studies whatever course or whatever. The point is he is not going to work. So this is the important thing. I agree with this idea. I mean, of course, the ideal would be the men to be, or the fathers being taking care of the children. But well, we want as well, like the labor market, to not to make this discrimination toward women, sorry, toward men, because they will be more professionally oriented, but like this situation to change. And with the narrative and everything, and this thing, Anina, that you mentioned about the angry fathers, the divorced fathers groups and everything, I belong here to one of these Men's for Equality Association, AIGE, that is here in Spain. And I always tell them, like, we should work more with fathers, because actually, if not, it's the responses they are getting are the wrong ones. It's like the only support they are getting are from these angry fathers, angry parents, I mean, or angry men. And I really think we should, or Men for Equality, we should as well lobby and demonstrate and you know, because if you are not, we don't consider ourselves fathers or Men for Equality, we don't consider ourselves as a lobby group, a pressure group. It's like nobody's going to listen to us, you know, but they will only listen to some, I mean, to the feminist movement, that if they take care of men, then the discussion will be there. But if they don't do, and this is what has happened in with the last government, like the men's issue will not be in the agenda. So somehow, sorry if this sounds shocking, but I think we should empower men, you know, for gender equality, because here in Spain, we have a very strong feminist movement, women's movement, and we men, most of us, we considering ourselves as feminist allies, is like being an ally doesn't allow you really like to show off, doesn't give you like the tools or the legitimacy to go in public, to say things. You are only like backing what the women says, which is something good, necessary, we need this, but it's like we don't feel with the legitimacy to, I don't know, like to ask every hospital to have men's groups for, I don't know, for mental health, or even paternity groups, which is something we are lacking. We don't have public services offering resources or activities for men, father, I mean, nothing like that. And if we don't foster this from the public services or the public policies, the responses are given from the private sector, and this is actually like the macho attitude and the most sexist point of view, and I think this is like really problematic. So somehow we need to reconsider the social consensus or the social pact about men, masculinities, and of course fatherhood.
Thank you, Miguel. Now, I'm sure on this issue of men, masculinities, and so on, I'm sure Maddalena has important things to say, but she's worked a lot on this. Maddalena, over to you.
Yeah, thank you very much, Annina, and thank you all for this very interesting discussion. I mean, well, I think that many things have already been said, and actually I realized that maybe it's because we usually are the Cinderella of Europe, and now compared to Portugal and Spain, we are also the Cinderella of Southern Europe. And maybe also because we are, I don't know, we are grieving now, or at least we are supposed to grieve one of the former presidents that devastated gender culture in Italy. I realized that I put just indirect on my slides. So, well, I'm very happy that other people that talked before me also put some positive insights. But, well, jokes apart, I think Italy is a very complicated country, and actually we still have these cultural norms on that act on different levels that are strong hindrance of fathers' engagement. And well, the structure of the welfare state is well known as a familistic and mother-centered. That means that care is delegated to family, but especially to women of the family. Concerning, since Giorgio asked me to elaborate a little bit on this, I'm gonna go fast because we are running out of time, but actually, our workplaces, and especially in the private sector, still have this long hours culture, and we still lack of company level policies, especially for the work-life balance. So, for example, flexibility is not always available, especially in middle and little firms, which are the most common in Italy. And actually the situation, especially for the youngest, is very precarious. So just to give you an idea, in the first semester of 2022, for men under 29, only the 12% of new contracts activated in this semester were open-ended, and the other were for the at least 50% of the contracts were the atypical contracts, so not just with fixed term, but also very precarious, like you work some days, for example, seasonal work or something like that. And that's a very, of course, important data to reflect upon, because from a certain point of view, it can also be a facilitating factor, because precariousness paradoxically oblige heterosexual couples to manage in a more equal way care duties. But it is true especially for well-educated couples, so with many differences among social classes, and also internal differences and regional differences in Italy. And fatherhood is actually in evolution, so towards a more involved model of fatherhood, but there are still very normative models of motherhood, intensive motherhood especially. And as also Nina mentioned, also on the field of masculinity, changes are very slow and very difficult to achieve. And we have these strong groups of men, of angry men and angry fathers especially, which is very peculiar, because they are very strong also in their advocacy role. They have strong connections with far right, with right-wing parties, and but they never, or at least very rarely mention the equal or participation in care duties. So and actually talking about narratives around fatherhood, their discourses and their claims are very present in public discourse in Italy, and so not at all from a feminist perspective. And well, of course, masculinity is still built around the breadwinning, and we also have this peculiar way of talking about engaged fathers, talking about this man as mammo, which is, in Italian, mamma is mother. So it's a way to delegitimize somehow men who are involved in care duties, because they resemble more to mothers than to men. So in Italy, we also have, talking about being a Cinderella, we have a very low employment rate of women, and also fertility rate, because as we know, they are, as Nina also said, female employment has a positive effect on fertility. But in Italy, we have a very as I was saying, again, precarious contracts also for women, and usually women leave the labor market or have especially very often involuntary part-time contracts, and especially if they have children. So in this sense, motherhood has a very negative effect on women's employment, and of course also on men's engagement in care duties, because they remain with the sort of the, let's say, bargaining theory. Of course, men feel less pushed to share care duties with their partners. Well, Tatiana talked about the provisions for children, educational, especially provisions for children, as a possible factor that both hinders and enables men's participation and involvement with children. In Italy, the situation is very bad from the point of view of nurseries. We have a coverage rate around 27%. In some region of the south is 10%. And this means that, of course, childcare is a family affair. As I was saying at the beginning, we have familistic welfare, but it is a women's affair, and not also for fathers. And another thing that I was thinking that it is important, and maybe it was not mentioned by the people who talked before me, is that in Italy is completely absent any form of gender, sexual, or affective education for children, especially in elementary school. And so I think this is an important factor that doesn't help to change gender norms and masculinity norms. Looking at leaves, Italy usually tend to simply just comply with European directives. So we just extended the paternity leave to 10 days of compulsory paternity leave. Now we have also some administrative punishments if the leave is not taken, and it is well compensated because it's paid 100% of the wage, but well, it's still 10 days. Another little bit, let's say, positive news is that now parental leave is not 6 months paid. Before it was just 6 months. Now it was extended, the compensation, for 9 months, and each parent has the right to use the 6 months of parental leave. So it means that we have 3 months paid of non-transferable leave, which is actually a factor of encouraging men's participation and use of parental leave. Even if persist many differences between workers in different employment conditions. The uptake of leave is still very low, especially the paternity leave is estimated that just 65% of men used paternity leave in 2000. Sorry, I can't recall. Maybe 2020. So we hope that these also administrative punishments will help men to use their compulsory paternity leave, but just allegedly compulsory paternity leave. And also parental leave has a very low uptake, and men represent now the 20% of users. A last thing that I want to mention is the service culture, both of health and education sectors. Well, usually there are no, and also Giorgio mentioned it, no national mandates or training on fatherhood in Italy, and some gender stereotypes still persist among frontline health and educational, early child education professionals, who, by the way, are also, especially in the case of education professionals, female, so reinforcing the idea of care as a primary female role. And the last point, Angela talked about it. In Italy, we have a strong medicalization of pregnancy and birth, and fathers are very rarely now especially involved in all these phases, and also during labor and after birth. And with COVID, the situation got very worse. So well, I will stop here. Thank you very much. I hope I was in time.
Yes, you were, but generally we've gone over time. So,
but you know that I'm German, yes, on this point.
Yeah, no, I know you've been very punctual. Yes, Aicha, I was wondering whether we could have an extra, maybe 20 minutes, half an hour. Would that be okay, or at least 20 minutes? Aicha?
I mean, technically for us, it's no problem.
No problem.
It's also
okay.
about our guests. If we are all together here, we can continue.
Okay, because I don't want to cut off Chiara, but before giving the floor to Chiara, I'd like to hear if there's anybody who wants to step in. Do our Belgian colleagues have anything to say? I mean, how does what you have heard resonate with the situation you have in Belgium? Would you like to say a few words, either of you?
Yeah, you hear me?
Yes.
Oh, perfect. There were a couple things that are in advance. I'm sorry for my English. It's not
no
very
problem.
A couple of things who interested me, especially like the political level. It's something in Belgium that we're a very small country, but maybe you noticed, but our government isn't the most efficient, if I can say it like this. We have different organs who needs to work together, but it doesn't work. So like fathers and gender equality isn't a priority. They also stated like that. Also next year we have, so every 4 or 5 years we have new elections. Next year we have new elections here in Belgium. It's going to be, the prognosis like extreme right. So it's very bad news for us. Like also the learning network I coordinate is the first network ever in the history of Belgium who brings partners together who work with fathers around gender, and also what Tatiana stated about role models, something that didn't happen before, but the funding stops this year. And now the elections are coming next year, so a lot of political figures are, how do I state it in English, they don't do promises because they just don't know what will happen in the coming years. So a lot of good initiatives here in Belgium just stop because there is no funding, and it's no priority for them. So it's very difficult to find motivated political actors, but also motivated organizations, also private organizations. It's not their priority. The only private organization here in Belgium is a car company, Volvo. They like in Norway and Sweden, they have like 16 weeks of paternal leave, and now they also did it in Belgium. So that's the first big private company here in Belgium who did something for fathers, but the rest is very little input of the big companies or governments. So sometimes it's like organizations who want to work with fathers, who want to initiate an idea. It's like sometimes a lone wolf adventure. So it's difficult, but not going to give up.
Okay, that's a little bit discouraging, but I think that it's a situation in several countries at the moment that not only is it difficult to move ahead in terms of engaging fathers, but we're risking a rollback on some of the things that we have already achieved, even in terms of cultural change. And that is something, you know, we have got to fight hard to keep, you know, to keep that process of culture change moving. This is also why in Italy, we think that the angle from which to approach this is children, child health, responsive parenting, because that's something that it's very difficult to say, I don't agree with this because I'm from the right, from the left, from the center. It should be a cross-cutting concern. So we think this may be a way of hanging on, you know?
I think the biggest difficulty in Belgium is that our care system is built on female workers. So a lot of men, a lot of fathers who reach preventive family support, like the organization I work in, they only see women. So it's like the stereotype. Yeah, I'm sorry for my English. It's like
it's reinforced.
They see only women to take care of their young children. So they think, okay, it's not my place. I'm not going to do it organization anymore. Like for an example, over here in my organization, we work with 12 colleagues, and I'm the only man. We have 3 or 4 likewise organizations here in Ghent, in Belgium, and I'm still the only man of, I think, 50 women. So that's also the problem. Like in kindergarten here in Belgium, the last publication of ciphers is like 1.5% of the caregivers is a man. And then we go to 3%, and then it's like the coordination of the daycare. So that's something, an issue I work around, because I think we need to start also with the education and to find solutions to bring more men to the family sector, to the social security sector, to make more male role models, to have a caring role with young children. I think it's very important for our future.
Thank you. Yes, yes, indeed. I don't see any other raised hands at the moment. Do you, Aita? Okay. So before I give the floor to Chiara, I'd like to mention also in reference to what the issue that Angela was raising, which is a very real one. I'd like to recall that we have we have a series of these workshops planned. We wanted to start with a very general one, but definitely a workshop that we'll be having is about leave, and where we'll be looking at some of the very complicated issues, how you increase uptake, and whether the time should be shared, not shared, and when. And also this important issue of how do you balance the need to adequately address the needs of women, or to give women real free choice, so the women who want to stay at home for 6 months to breastfeed their babies can actually do it, and they're decently paid for that, with the goal of eventually reaching truly equal sharing of care between women and men over a period of time. So we'll definitely be bringing that issue up again, and we keep it on the back burner, which is it's a very relevant issue. So unless Aita and Mihaela, you have anything else to say now, can I ask Chiara to make?
Yes, please.
Okay, go ahead, Chiara.
Okay, thank you for inviting me to this very interesting, to this very interesting short workshop. I try to pinpoint what some issues which came across many of the intervention. The first one is evidence, and which the issue was raised first of all by Giorgio Tamburini. Well, I must say that evidence, of course, is necessary and important, but is not enough. I mean, policymakers and even individual people are not persuaded by evidence in itself, because the way people read evidence, come from their values, ideologies, ideas of what is good for them or for the world and so on. So there is a problem of gathering more evidence or being able to communicate it, but there is also an issue of how to encourage a friendly acceptance or a friendly hearing of the kind of information we have to propose. For instance, benefits. In your position paper, there is a long list of well-known benefits for children, for women, for families, for men, for fathers themselves. But these benefits cannot be perceived as such by everybody. So I mean the Italian case, but from what I understand, even the Belgian case, I mean, one may not be so positive about gender equality or too much, quote unquote, women's modest labor force participation, and particularly for the case of fathers, I think that one of the priorities is to address the negative view of the caring father. Because there is a lot of, not only ideological, there are a lot of fear around this. Also by some psychologists, by some pediatricians. So we cannot just say that they are conservative, I would say backwards and so forth. This is an issue which must be addressed because many fathers who are actually involved in the care of their children feel insecure whether they are doing the right thing. There is a Manuela Naldini is not here, but she has done some study on fathers being involved. And there is this fear: am I legitimized to do it? Am I doing the right thing for my child? So it's not on. So there is really an issue when we speak about persuading, encouraging fathers to be more involved. This is the first issue to be addressed, which concern both the well-being of their children, the good development, the adequate development of their child, but also maleness in itself. So am I giving the right idea, the right role model as a father? So we should not take as given what we know about the benefits of involving fathers. We have to persuade people that these are actual benefits also for them. And concerning fathers, I would stress, I mean, we have to address multiple actors. You speak of stakeholders, I speak of actors, so fathers, employers, policymakers, pediatricians, social workers, teachers, and we have to find what is the, I would say, the main, what could be the main turning point for that, what could be the entrance in making them sensitive, which could be different for different actors. And for fathers, I think that we should stress first of all, not only the well-being of their children, the good development of their children, but also their own well-being. So somebody, I think it was Miguel Lazaro, who said that we should empower fathers in the gender equality. So gender equality for them, so that they are, that it is good for them. It makes them grow, it expands their capacity, their experiences. That is a good thing for them. It's not only because they have to help their companion, their partner, or because it is good for gender equality, that is for women. It is, as long as they are not persuaded that it is good for them, they could just feel that they are generous, but it's something that is something that can be there or not there, or they can repeal. I would be a little bit cautious in saying that it's good for natality as well. Not only because people can have very different ideas about the need to increase natality, but also because data are very ambivalent about the impact of involving more fathers in care, in early child care on fertility. The data are still too few, and they concern mostly the Nordic countries. There is something also in Spain, but it's very short-lived. And it shows that actually, at best is neutral. At best is neutral. And at worst, it's even counterproductive. I mean, there are many fathers who say, this is also in my impressionistic experience, I meet many fathers who tell, okay, I was so involved in my first or second child, I do not want a third. I mean, that enough is enough. Okay, so I did my duty, it was nice, I enjoyed it, but no more. There is something else I want to do with my life, as women want, and now often say. So we could use the pro-natality argument, but with some caution. So it encourages maybe women to have an extra child, not necessarily a father to have an extra child. And since they have to decide together, it could be a null exit. I think we don't have the time here, and probably it depends on the country, and even on the local context specificity, but we should be careful in finding, I mean, Anina, you are right that the approach should be integrated. Of course, we should not forget that gender equality goes together with the well-being of children and so on. But when arguing towards a specific targets, we should find the entrance, at least. What could be the main interest of that specific actor. For employers, for instance, could be everything could be negative, or for employers, that is, not only they have women, as your Spanish employer said, okay, now also men. It's not enough to having women who take the leave. Now we also have men, so they're all unreliable. But here, this could be linked to the discourse, which is apparently in a totally different field, but which is emerging on the fact that particularly the younger generation do not want to work in order to live. They want to live and they want a more integrated life. So if employers want to have employees who are faithful, they do not only have to pay well them and to acknowledge their abilities and their professionality and so on, but they have to give them space for what the other dimensions of life, among which there could be also fatherhood. So it should be a discourse integrated in the new culture of work, which is emerging as a demand or also as a refusal, that is the living of jobs because they do not satisfy this kind of needs. It is risky, but also because it's risky, also because it was not mentioned. Only Maddalena Cannito, I think, mentioned it at the end. That it was not mentioned how many fathers, not also mothers, but also how many fathers are entitled to this kind of to leaves, for instance. Which are we can there can be intervention during pregnancy. So there is a lot which can be done for fathers irrespective of their employment status. But the entitlement to the leave, which is a big piece of the involved fatherhood, is too much dependent, at least in some countries, not in all countries, but in some countries is depending on having a job and what kind of job, what kind of contract, and so on and so forth. And not only the kind of contract, but even if they are entitled, but in a very insecure environment, they may feel that they are not, they cannot afford to take what they are entitled to. And also there is the need of information. I was just reading a paper very recently which showed that even in countries with similar provisions in terms of duration, generosity, and so on and so forth, two things made a big, huge difference. One is information, the kind of access to information to what one is entitled to. And the other is the attitude of employers or supervisors or whatever. And that, so it's not only, it's a work which should not be done that with the enterprises, not only at the level of, let's say, of the high staff, but at the level of human resources people, and that even at the level of the medium staff, because that makes a difference, important also for women, also for mothers, but also for fathers, particularly for fathers, since they are, let's say, in a different way from mothers and fathers, because mothers are expected to be on leave, fathers are not yet expected. And so their behavior is perceived as more as is deviant from what is expected. So that is important. But the main thing is that too many fathers, even more than mothers, are not entitled to anything in this field. So one should work also on entitlement, and I don't know whether it is a task that you pose to your project, but maybe to look at whether all countries have this kind of entitlement linked to work contracts or not. For instance, I know that in Germany, parental leave was available also to people having a scholarship or having a temporary contract, which is not the case in Italy. So we could also work maybe on making more universal this kind of knowing, on the other hand, that not everybody can afford to stay too long out of the labor market. That is true for women, for mothers, and for fathers alike. So you cannot take, you cannot not always afford to take a very long leave or to take a leave at all, particularly if you are self-employed or so, which is a problem. Okay, I hope not to have made more confusion.
Thank you, Chiara, so much. As always, very deep thought-provoking, and she's put a lot of issues that we need to continue to think about. On this issue of the leave, of the entitlement, one of the jobs of 4E-Parent is to come up with policy proposals, and obviously leave is going to be one of the topics. But we cannot increase the entitlements of those who already have them without thinking about those who don't, because otherwise we will not be doing good, we will just be increasing inequalities. So whatever proposal is made, we must take into consideration how to extend this right to others who don't have it, and thinking about some other mechanisms. It might not be leave, it might be money to cover a period when people are not earning. We have to think very creatively about this, but she's perfectly right. Otherwise, we're just going to increase inequalities, and that we can't do. We can't afford to do. I think we can close here. Michaela, Giorgio, will you be saying some final words? And Chiara, thank you again so much.
Welcome. It was a pleasure.
Giorgio, do you want to say something?
No, just, well, a big thank to everybody. As Anina has anticipated already, this first of a series of seminars. Many issues have been brought today, such as the parental and paternal leave. This is for sure something that we have to give more in depth. A second was mentioned by Chiara, that we have to consider the different entry points for the different targets. And so even the role of evidence, of course, as you said, is much different according to the target we have. Then we have the employers' policies. We have the point of the benefits for fathers and how to get into more in depth into it. And finally, I would even mention one thing, which is how to start from school, because of course stereotypes about roles have to be addressed from there. Finally, just one thing, but probably Michaela wants to mention the other project we are engaging, which is EMING, right, Michaela?
I will just put the slide now, because I think that there are different initiatives that are perhaps following the same purpose. And I think it's very important that we kind of bridge these initiatives and see how they can convergently or conducively are promoting messages that are consolidating a narrative that we have contributed to today, I think. And as I said, I think there are different narratives for different actors, and there are different engines that make people be moved by the way that we are promoting fatherhood or man involvement. And that's engaging men in nurturing him, because again, we start from children. We start from children. It is for them first that we consider that fathers are so important, and men in their life are so important, especially in the first moments that they have come to the world. And the project involves countries that have been mentioned here, and they have been present today, but it does not focus only on those countries, because it works at the country level and city level actually, and also at the European level, because eParent is doing the same. It's focusing on Italy particularly, but has ambitions to influence the European narrative and also learn from the European context what are the ways in which the problems can be best addressed according to the country context. The project, it will unfold for 3 years, and will have the same advocacy, an advocacy-oriented part, but also consolidating this narrative and policy influencing at the European level and at the country level. But also, as usually, I very much agree with what Chiara said, that evidence is not enough. no, it's not enough, but we need to come with also with solutions. And we need to build that narrative on something that has been proven that it can work and it can bring more than just scientific data, that it can have an impact. And it's an ecosystem that creates this new culture of seeing equity, equality, and shared responsibility. And that's what also the project wants to look at, how we can champion programs, initiatives, penetrate the pre-service, the in-service training of those that are working with fathers, families, and of course impacting children, how we can create that kind of examples of programs that can inform further. It can be done, and it can have multiple benefits. This is something that I think it has to be a country narrative, not only a European narrative. And as it was said, the evidence might be sit in different pockets from different countries, but I think that needs to be an also narrative at the country level that needs to be built on experiences that have been successful. And that's what we intend to do with Engaging Men in Nurturing Care initiative. That said, eParent is our friend in the EMING initiative, and we will try to cross-fertilize the work that is done in both. And the same will be for Spain and Portugal. And we will find ways of bridging with other initiatives, because it's not, yes, projects are having specific period and funding, but the message that we want to get across, it's something that is more important that we try to achieve through the projects, which are short-lived. What we want to do is like long-lived outcomes. And that's what we will certainly look for. So there will be many opportunities either in eParent, for eParent, or under EMING. Well, we will continuously come together, sharpen our messages, organize better ourselves in our influencing work, but also advancing the work that proves that things can change. And that's something that obviously will take some time when we're realistic about it. But I think that if we don't start doing it in many places, then definitely progress will be not noticeable. And last but not least, as we are within the 40 Parent project, there is a website, and we will certainly share with all those that have been present today all the details and the PowerPoints itself, so that you can stay updated with what's happening under the project. But also if there are ways in which we can leverage whatever happens in 40 Parent in other initiatives, or strengthen the messages in other programs that each of us as individual organizations are involved. Well, mea culpa, nostra culpa, colpa per il tempo. So that we've not been good in managing the time, but we promise to do it better next time. I think that we all appreciated all the contributions, and a big, big thank you to all of you for staying with us until this hour. And definitely we look forward to having you with us. If this was interesting and it was engaging in a collective reflection, that we promise we will continue in the next meetings in autumn for sure, because all of us, I think, deserve a summer break soon to come. Thank you very much again on behalf of the ISA, but also of the 40 Parent, and big thanks to Giorgio, Anina, Aicha, that have been intensively worked on putting up the workshop, and to all our guests together.